I'm Kelley Hall, and I am a breast cancer survivor. I was laying in bed, and I had my arm over my head and felt a lump, and it scared me. I went to see my doctor in Atchison, and she had me do a mammogram and some other tests, and sure enough, it was cancer. We go to St. Joe a lot, so we decided to go to St. Joe to Mosaic Life Care. It's a team effort. I did the chemotherapy to shrink the tumor for my surgery. Dr. Stuevey was my surgeon. I chose to have both breasts removed, and she asked me what I thought about reconstruction, and I did not think it was necessary. I wanted to get rid of them. I was scared of them. And she said, you're only 52, you're really young. So she really encouraged me to speak with the reconstructive surgeon, and she said he's really good at what he does. He's very easy to talk to, and I think you'll be pleased with the results. So we met with the reconstructive surgeon, Dr. Amspacher.
So Kelley's a very nice lady, and she's very optimistic and always has a smile on her face, but she had some tough choices ahead of her. She'd been diagnosed with a fairly aggressive type of breast cancer, and she had come to the decision that she was going to have something called a bilateral mastectomy, which is where you have both breasts removed in order to decrease your risk of breast cancer and breast cancer recurrence. She wasn't really sure what she wanted to do with reconstruction, though, because it was another thing and another big decision for her.
He was amazing. He really was, right from the start. I was nervous. I was really nervous about all this, and he just put me right at ease. He put my husband at ease, too. And I think my husband had more questions than I did.
It's a big undertaking, and unfortunately there's a lot of misconceptions and just some bad information out there. And so I took time, went through the process, told her about what's involved, what the options are, and what I thought she would be a good candidate for.
He went over every single detail. Everything. I didn't even have to ask questions because he gave me so much information. But I think it was also, he was real compassionate. He understood what I'd been through.
The general surgeons and I worked together on the very same day in order to get her reconstructed. They did the mastectomy, and as soon as they're done with the mastectomy, I take over and do the breast reconstruction for the patient to get them headed towards the final goal.
For having to go through this, overall it was a good experience. I was very pleased when I saw the end result. It's amazing that right here in St. Joe that you have such good professionals. They're really good at what they do. They really are. I was impressed.
Everyone from the nursing to the doctors to the nurse practitioners to the surgical techs do a wonderful job, and they really have the patient's best interest at heart. And I think that we truly are able to deliver world-class care without the big city hassle.
With cancer, you lose a lot. You lose who you are. You lose your identity in a way. But to get back to looking like me again, helped me to get through this whole process. So I feel more comfortable with myself again. I lost my confidence. I have my confidence back. How do you thank these people who gave you so much? And they gave you back your life. They gave you back your normal. Thank you. Thank you. Thank you.